My name is Sara Ludwig, and my role here at Accolade is I am a nurse case manager. I chose to work for Accolade because there's a lot of changes in the American healthcare system, and there's a lot of barriers that a lot of folks are really struggling to navigate just because they don't know and understand how to navigate the healthcare system. I did have a lot of experience in the hospital prior to working at Accolade, where I would discharge a lot of my patients and I knew they were going home to a situation where they would struggle a lot without help. Accolade makes that entire situation so much better by being able to educate them on the in-network providers we can get them connected with if they're discharged without any appointments with any specialists, if they need to have home health care ordered, physical therapy, occupational therapy, and we also help them with caregiver support. In the case that I am going to talk about, the wife of the member was a Spanish-speaking individual, and she really struggled with understanding what was happening with her husband as he was trying to heal in the ICU. Accolade was able to provide a bilingual representative to help her navigate discharge and the whole process of getting what he needs when he's finally home. The member is a 53-year-old man. He was a triathlon athlete, and he was out biking one day and he was hit by a car. Unfortunately, he had to go to the hospital, and he had multiple surgeries to address 5 different fractures that he ended up sustaining. And he also had a small bowel perforation that was pretty severe. Once the member left the hospital, Accolade discovered that he was discharged without any home health care, no physical therapy, occupational therapy, and he was given a wound vac for his surgical incision to help with facilitating healing. However, when he was discharged, he didn't have too much education on how to clean the wound vac, and his wife was very overwhelmed with how to manage all of this. Accolade was able to provide support after our member was discharged by doing an extensive in-network provider search for a outpatient wound care center. We were also able to contact the hospital to see if they could facilitate in finding a home health care agency, physical therapy, occupational therapy. When Accolade followed up with the member again, after we did all of those interventions, we ended up hearing from them that he was back to biking again. He was doing very well in physical therapy, occupational therapy, and he was also planning on doing a triathlon in the near future. We were able to advocate for this member to get what he needed after he had such a severe accident while he was doing something he loved. We were able to help save $29,000 for the member simply by getting him in contact with in-network providers. I cannot imagine the struggle that he went through and the multiple surgeries that he had to try to navigate by himself. The part of my job that brings me a lot of joy and purpose is being able to actually have a hand in making sure people get what they need. And I feel like I'm able to get them on the right path towards healing by giving them the services that they need that they may not even know they need.